Zombies have become a popular cultural phenomenon in recent years, with countless movies, TV shows, and books featuring the undead creatures. But could zombies actually exist in real life? The answer is both yes and no. On the one hand, the idea of a zombie outbreak where the dead rise from their graves and start attacking the living is purely fictional. There is no scientific evidence to suggest that such a scenario could occur. While certain types of parasites and fungi can hijack the brains of insects and other small animals, there is no known mechanism by which this could happen in humans. However, it is possible for a person to exhibit zombie-like behavior as a result of certain medical conditions or drug use. For example, people with Cotard syndrome, also known as walking corpse syndrome, believe that they are dead or do not exist. This can lead to behaviors that resemble those of zombies, such as a lack of responsiveness and a disconnection from reality. Similarly, drug use can cause a person to exhibit zombie-like behavior. The use of synthetic drugs like bath salts has been known to cause hallucinations, paranoia, aggression, and other behaviors that resemble those of zombies. However, it is important to note that these behaviors are the result of drug-induced psychosis and not the result of a viral outbreak or other external factor. In addition to medical conditions and drug use, the idea of a zombie outbreak has also been explored in the context of potential viral pandemics. While it is unlikely that a virus could cause people to become literal zombies, there are a number of real-world viruses that could potentially cause widespread illness and death. For example, the Ebola virus is highly contagious and can cause severe hemorrhagic fever, leading to death in up to 90% of cases. In conclusion, while the idea of a zombie outbreak is purely fictional, it is possible for people to exhibit zombie-like behavior as a result of certain medical conditions or drug use. The fear of a zombie outbreak has also been explored in the context of potential viral pandemics, although the likelihood of such an event occurring is low. While the idea of zombies may be entertaining in fiction, it is important to remember that the real-world threats posed by viruses and other diseases are far more concerning and deserving of our attention. What are some real-world viruses that we should be concerned about? There are many real-world viruses that pose a threat to human health and well-being. Some of the most well-known and concerning viruses include COVID-19. The COVID-19 pandemic, caused by the SARS-CoV-2 virus, has had a profound impact on the world in recent years. The virus is highly contagious and can cause severe respiratory illness, leading to hospitalization and death in some cases. Ebola virus. The Ebola virus is a highly contagious virus that causes severe hemorrhagic fever. The virus is spread through contact with bodily fluids and can lead to death in up to 90% of cases. Influenza. Influenza, or the flu, is a highly contagious virus that causes respiratory illness. While most cases of the flu are mild, the virus can be life-threatening in some cases, particularly for young children, the elderly, and people with underlying health conditions. HIV. The human immunodeficiency virus, HIV, attacks the immune system, leaving the body vulnerable to other infections and illnesses. While there is no cure for HIV, antiretroviral therapy can help manage the virus and prevent the progression to AIDS. Zika virus. The Zika virus is spread through mosquito bites and can cause a range of symptoms, including fever, rash, joint pain, and red eyes. The virus is particularly concerning for pregnant women, as it can cause birth defects in babies. Hepatitis B and C. Hepatitis B and C are viruses that can cause liver disease and can be spread through contact with infected blood or bodily fluids. Both viruses can lead to chronic liver disease and liver cancer if left untreated. Measles. Measles is a highly contagious viral infection that causes fever, cough, and a characteristic rash. While most people recover from measles without complications, the virus can be life-threatening in some cases, particularly for young children and people with weakened immune systems. These are just a few examples of the many real-world viruses that pose a threat to human health. It is important to stay informed about these viruses and take appropriate measures to prevent their spread, such as getting vaccinated, practicing good hygiene, and avoiding contact with infected individuals.